I know you've learned many new things. That's my prayer. So, just a summary of the whole thing. We've come to the end of the training. Day 1, I just want to give a recap or summary of what we've done up to this point. You remember day 1, what did we learn? We started by we introduced the terms, the common terms that we have been using all through the training, terms like hygiene, sanitation, diarrhea, epidemic, pandemic, and all those terms. Then we've covered personal hygiene. Under personal hygiene, we focused more on hand washing at the 5 critical times, so hand washing with soap. Then after that, we also talked about personal hygiene from head to toe. Then we focused on solid waste management. That was the other topic. So under solid waste management, we looked at classification of solid waste. We defined what solid waste is. We looked at the objectives of solid waste and solid waste disposal systems. That was day 1. Day 2, we did a review or a recap of day 1 activities. Then we focused on safe water handling and storage. We looked at properties of water, how to treat water, and things like that, how water gets contaminated. Then the other topic was proper excreta disposal. So we started by defining excreta. We said excreta means feces and urine. Then we looked at the objectives of proper disposal of human waste or excreta. Then we looked at the conservancy systems, or the the excreta disposal systems. We mentioned many of them: bucket latrine, traditional pit latrine, VIP latrine, stretch latrine, overhang, power flush, and the others. Then after that, we did communication skills or interpersonal communication. So we defined what communication is. We also had a role play on how to ensure that the message does not get lost along the way. And we also mentioned some of the communication skills. We said we have verbal and non-verbal. We also said non-verbal basically reinforces the spoken word. We said you can use things like gestures, body posture, facial expression, eye contact, and the rest. We also looked at the barriers to communication. We mentioned which ones? Culture, religion, age, education level, noise, language, and channel used, and technology, isn't it? And stuff like that. So today was the day 3. So today we started by doing a recap of day 2 activities. So then our main focus for day 3 was we focused on diarrheal diseases, prevention and control. We started by just giving an overview about diseases. We said diseases are divided into 2. We have communicable and non-communicable diseases. But for our case in public health, we say that we focus mostly on communicable diseases, those diseases that we can prevent and those that we can control. So we gave some of the reasons why communicable diseases, it's important to focus on this. We said they are common, they're easy to prevent. We said some of them cause disability. Some of them are common, especially for children under 5 years. And if not treated in good time, they can lead to death. Sawa? So non-communicable diseases, we listed some of them. We said cancer, the diabetes, the hypertension, But for our case, we don't focus mostly on non-communicable diseases. Then after that, we looked at the disease determinant factors. We said for a disease to exist, any disease in this world, we must have three things. We said we must have an agent, host, and the environment. Then we went ahead and defined what an agent is, what a host is, and what the environment is. Then we said it's the cycle, the triangle looks like this. We said we have the agent, the host, and the environment. So we said if this triangle continues to be what? Continuous, people will continue to get sick. So we said our aim is to ensure that we cut what? The cycle. So we said we can cut the cycle at the agent level. We said at the host or at this other point, the environment. So we gave many examples of cholera, how we can prevent malaria, HIV, and AIDS. So we said for us to be able to prevent any disease, we must know at what point we are going to break the cycle. So we gave examples of how malaria, the disease, how it gets to us. We also looked at HIV as another example. So we said we need three things for us to be able to prevent and control diseases. Number one, we say you attack the source. We must know the source of infection. If it is cholera, where is the source? Is it water? Is it food? If it is HIV, where is the source? Then we said number two, we interrupt the transmission route. Then number three, we said we protect the host. Host in this term is saying a host, we said a host is any person who offers lodgement or who harbors a disease. Or if you give lodgement, if you become like the house for the microorganism to survive, then we say you are the host. Then we went ahead and classified diseases. We said we have airborne diseases. We have diseases that are spread through the fecal-oral route. We have vector-borne diseases. We have the nutrition-related diseases. We have immunizable diseases. And then we have the sexually transmitted infections. So for our case, our main aim, we focused on the diseases that are spread through the fecal-oral route. So we said we have cholera, we have typhoid, we have dysentery, watery diarrhea, hepatitis B, idiasis, and many others. Then we went ahead, we picked cholera. What we said, that all the diarrheal diseases, they have the same prevention and control measures. So how you prevent cholera is the same way you're going to prevent typhoid, dysentery, and the rest. We said what differs is the incubation period and the causative organism and the signs and symptoms. But the prevention and control measure is usually the same for diarrheal diseases. For STIs is the same, for vector-borne is the same, and like that. So we said what cholera is. We defined cholera as profuse watery diarrhea. So it's characterized by profuse watery diarrhea and it's caused by a bacteria known as Vibrio cholerae. So we say the incubation period is between 24 to 48 hours. Then we went ahead and listed the signs and symptoms. We said one of the main characteristic sign of cholera is what? Rice water. So that's what differentiates cholera from all the other diarrheal diseases. And we said there is severe dehydration, vomiting, restlessness, and stuff like that. So we also said if the patient is not treated in good time, due to dehydration, the person goes to what? Shock, then the person dies. So we looked at the prevention and control measures. Number one, we said you wash your hands with soap and water at the critical times. we said use of a toilet. We treat water through boiling or whichever method. Then proper handling of food. And then we said it's important to have early or prompt treatment of cases. So all suspected cases should be treated early enough. Then the last bit, we looked at the F diagram. We said we use the 6 F's so that it's easy for us to remember. So we say the first F is feces. We have food, fluids, feces, and flies. So we also went ahead, we did group work. Then, using the F diagram, we established how feces get to our mouth. We said it is called, these diarrheal diseases are transmitted through the fecal-oral route because feces gets into our body through the mouth. So that's why it's called fecal-oral route. So that's why we have feces here and mouth. So we went ahead and described or explained how feces gets through to our mouth. We said it gets through fluid, food, fingers, and flies. We call it the F diagram. Then lastly, we looked at how we can put barriers so that feces does not get into our mouth. We say the best method, the best strategy is use of toilets. Because if people do not defecate in the open, then there will be no feces. So if you get rid of feces, then we will not have the diarrheal diseases. Sawa. So we said use of toilets, we talked about proper food handling, washing hands, proper treating our water, and covering our sawa. Then the last thing, we talked about formation of school health clubs. We said it is important for us to have a school health club. And as those of us who've been trained will be like the patrons. We are the ones who are going to spearhead things to do with health, hygiene, and sanitation in our school. So after that, we've come up with an action plan for February to September. Then we'll be monitoring it monthly to see the progress. I think we've learned a lot. Have we learned or we have not learned? We've learned. Learning has taken place. But we want to see now the learning being put into action. So we are going to type for you on Monday. So for my side, I just want to say thank you for being good students.